Hello, this is Chris from the Obstacle Doc, and today we're going to talk about wrist mobility, differentiating between soft tissue restrictions and possible joint-related restrictions as well. So Danielle is going to demonstrate a variety of progressive, kind of easier to more intense soft tissue stretches, and then we're going to demonstrate a self-mobilization with our band if our clinician suspect that there might be actually like a bony block or a joint-related stiffness that's a little different than musculature. So our basic wrist extension and flexion stretches that you can do. If we bring one arm out, Daniela is going to pull down with her wrist, with her offhand, in essence stretching the extensor compartment of her forearm. If she wants to stretch the flexor compartment, we're going to flip upside down, grab and pull back, and that's going to get the inside complex. We also have rotation as well, so we're getting rotational stretching in addition to wrist extension. If we want to create a little bit more leverage, we can come to any surface, table, bench, and we can apply the same type of concepts. So right now we're working on wrist extension, soft tissue stretching, as her fingers are facing forward and we lean body weight into it. If we want to work on wrist flexion, now I will caution, this is a little sensitive to be in this position, so go into this gently and get used to it first before you put a lot of leverage on it. We want to make sure the elbows are straight, and we're going to lean into it to get a nice stretch across the top of the forearm. Again, this is a little sensitive on a hard surface, so take your time with this one because it can be a little abrasive. As our third level of progression, we can use even more body weight. And going into a tabletop position, we can lean forward. That's going to stretch wrist extension. If we want to get even more out of that, we're going to flip her fingers facing, actually the other way. We're going to flip the fingers facing this way towards the knees. And as Daniela leans back, we get a big stretch across the front, stretching her wrist flexor and finger flexors. Then to get extensors, again, be careful with how aggressive you want to put weight. Start gentle, and then we're going to get a nice stretch here as we lean back. All stretches should be held for about 30 seconds at least. I'd say 30 to 45 seconds. That takes about enough time to start to get some elasticity to occur in the soft tissue structures. You can repeat stretches anywhere between 2 to 3 times as you go. Stretching soft tissue restrictions takes a while. It's not a fast fix, but it can be something that can be used to complement a warm-up before you're about to do whatever you're going to do. It can be used as a cool down to kind of open up tissues that you just repeatedly overused. So think of all the climbing, the lifts, all the hand grips. You're going to develop tension, so you can utilize it as an appropriate cool down method. You can couple soft tissue, so Theraguns, foam rolling, trigger point ball into these same muscle compartments. Oftentimes that's a nice 2-for-1 strategy, and it'll give you a little bit better response than just stretching alone. Any of those soft tissue gadgets are fine. You can spend anywhere between 1 to 2 minutes working the forearm first, and then pick whatever stretch appropriate that you would like to do second. Okay, we are going to look at now potentially the idea is if you actually have a bony restriction or a joint stiffness that's actually restricting your wrist extension. This will typically present as a pinch across the top of the wrist when you're in a wrist loaded position. So think of your push-ups, think of your planks, renegade rows. Anytime you're in a full position like that under weight, there can be, think of it like a rusty door hinge where that wrist can't extend all the way back because the little bones inside are either stiff or just not moving as well. So one of the ways you can do this on your own to mobilize it to complement what we can do in clinic is to take a resistance band. You're going to wrap it so that it catches underneath the two bony bumps of your wrist that are pretty easy to kind of see here and feel on yourself. You then need to take your resistance band, you need to anchor it to something away from you. So whatever that is, a pillar, a post, it doesn't really matter, but you need this to stay fixated. From this point of view, depending on how much stretch tension we have, Daniela is now going to lean her forearm forward, and in essence, creating our mobilization effect because the band is guiding the joint backwards, the opposite direction, facilitating that hinge at the wrist. Again, this is meant for joint stiffness more so than soft tissue tightness, which does present differently. Again, our joint stiffness cases are usually going to present as a more sharp block discomfort at the top of the wrist, whereas our muscle tightnesses are going to be more throughout the forearm. You can take the offhand to kind of augment the position as you go. You can also work quadrants. So as she leans forward, she can also steer forward, inward, forward, 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 outward, kind of working that arc of movement as we go forward. Mobilization, again, for about 30 to 60 seconds. We're working into stiffness. Now, whereas we don't want this to be sharp and painful, we do have to understand that as we're going into stiffness, it may have a discomfort with it. But the goal would be is that after we mobilize, if we were to retest those same positions of trouble, if it feels easier to get into, we have done a successful job to temporarily loosen up that wrist joint. We may need to repeat this at least daily for a period of time to kind of really normalize that out. This can also be done as a great pre-load exercise strategy. So before a class, if you know you're going to challenge that position, doing this before you start the class. If you're going to do any lifting that has a really wrist extended position, you can do this first to get yourself ready to go. That way, when you are actually doing the exercise of choice, you've maximized your motion beforehand.